সুস্থ থাকার সেরা ঠিকানা আইএলএস হসপিটাল, আগরতলা। At ILS Hospitals, your health is our happiness.
Blood is considered a fluid connective tissue that functions to distribute substances critical to life to cells throughout the body. If we take a unit of blood and spin it in a centrifuge, it will separate into its basic components. At the top is a fluid called plasma that represents about 55% of our total blood volume. Next is a thin whitish layer called the buffy coat. This layer contains platelets and leukocytes, which account for less than 1% of our blood volume. The remaining nearly 45% consists of red blood cells called erythrocytes. A mature red blood cell is a package of oxygen-carrying hemoglobin molecules and respiratory proteins. Its biconcave shape provides a larger surface area for oxygen diffusion and allows it to fold and squeeze through small capillaries. Leukocytes are white blood cells that help fight disease. Platelets are cell fragments that circulate in the blood and promote clotting. When the wall of a blood vessel is injured, platelets adhere to exposed collagen fibers and release chemoattractants that bring more platelets to the site. The injury is initially sealed by a plug of platelets. Then a clot of fibrin and red blood cells forms, giving the vessel time to repair itself. Plasma, the liquid portion of blood, transports blood cells, proteins, and enzymes to sites where they are needed. Blood transfusions are often needed to treat patients whose red cells or volume of blood have dropped too low. But it's critical that the blood to be transfused be matched to the recipient's blood type. There are 4 ABO blood types: A, B, AB, and O. Each is characterized by the presence or absence of different antigens found on the surface of red blood cells and the presence or absence of different antibodies circulating in the blood. Rh factor is another antigen found on the surface of red blood cells. Individuals with Rh positive blood have that antigen. Those with Rh negative blood do not. Any of the ABO blood types can be positive or negative for the Rh factor. If the blood to be transfused isn't matched to an individual's Rh factor and ABO blood type, antibodies can bind to and destroy the transfused red blood cells, creating a potentially life-threatening situation.
Blood is a vital substance that delivers oxygen and other essential nutrients to cells throughout the body. It consists of red blood cells, white blood cells, platelets, and plasma. Each of these blood components serves a different function. Red blood cells enter the blood from the bone marrow. These red disc-shaped cells carry hemoglobin, which plays a critical role in oxygen exchange and delivery. White blood cells arise from the bone marrow and lymphoid tissue and play a role in fighting infection and inflammation. There are 5 types of white blood cells, including neutrophils, eosinophils, basophils, lymphocytes, and monocytes. Platelets are vital to clot formation and hemostasis. These small, nearly colorless cells are formed by the bone marrow, lungs, and spleen. Plasma holds the red and white blood cells and platelets together.
Blood consists of a liquid portion and cellular components. The liquid, called plasma, is where nutrients, hormones, clotting factors, and other chemicals are dissolved. The cellular components are suspended in the plasma. They consist of red blood cells, which transport oxygen and carbon dioxide, white blood cells, which fight infection, and platelets, which are small subcells that help the blood to clot. Blood cells are made in the bone marrow, a soft tissue housed inside many of your bones.
Blood transfusions are prescribed for several reasons. Although less commonly used, whole blood may be given to rapidly replace lost blood, as in hemorrhage. More commonly, specific blood components, such as packed red blood cells, platelets, and fresh frozen plasma, are ordered to manage different conditions.
Blood groups and blood compatibility. Karl Landsteiner established the possibility of grouping blood into 4 types depending on their behavior when mixed together.
To begin the transfusion, an intravenous needle will be inserted into a vein in your hand or arm. A bag containing the donor blood will be hung nearby, and the blood will drip slowly through a tube attached to the IV needle, allowing it to run through your vein into your bloodstream. Throughout the transfusion, your temperature, heart rate, breathing, and blood pressure will be monitored. After the bag is empty, if you require more blood, another bag will be attached to the IV tube. When your transfusion is completed, the needle will be removed.
Human blood has 2 major components, namely blood cells and blood plasma. The membrane of the RBC has 2 types of proteins called antigen A and antigen B. The plasma contains 2 types of proteins called antibody A and antibody B. The 4 types of blood groups are A, B, AB, and O blood groups. These letters refer to the antigen present in the red blood cell. That is, A group has antigen A, B group has antigen B. AB group has both the antigens A and B, while O group has no antigens in the red blood cells. The antibodies A and B in the plasma can react with corresponding antigens and coagulate the blood. So plasma of A group blood will have only B antibody. In B group blood, A antibody is present. AB group has no antibody, while O group has both A and B. The reaction between antigen and antibody has a lot of significance in medical science. Before any blood transfusion, doctors make sure that the blood groups of the persons involved are compatible. Let us see how this happens. Take 2 drops of blood from an individual with any blood group. To each of these drops of blood, add a drop of antibody A or antibody B. What do you expect to notice? If the blood drop coagulates with antibody A and not with B, it is group A. If the coagulation is with antibody B, it is group B blood. If coagulation is caused by both the antibodies, it is group AB blood. And if there is no coagulation, it is O group blood. Conclusion. The blood group testing is based on the property that in any individual, the antigens and antibodies are never the same, because antibody A agglutinates antigen A. Similarly, the antibody B agglutinates antigen B.
Red blood cells carry oxygen. When your red blood cell level or hemoglobin level drops, either from your cancer or blood problem or from the treatment for your condition, you may feel short of breath when you walk, especially up the stairs. You may feel lightheaded or dizzy, or you may feel your heart racing. These are symptoms that tell us your body is not getting enough oxygen. This is usually when your hemoglobin level drops below 65 to 90, but may vary from person to person. Red blood cell transfusions will relieve these symptoms and make you feel better. The second kind of blood product is platelets. Platelets are cells that stop you from bleeding. If your platelet count drops to a very low level, usually below 10, or you have bleeding, such as nosebleeds, your physician may recommend a platelet transfusion. If you decide to have a blood transfusion, your physician will ask you to sign a consent form for blood transfusion. By signing this form, you are stating that you understand the benefits, risks, and alternatives to blood, and that you've had all your questions answered. Next, you'll have a blood sample drawn to determine your blood type. The blood transfusion laboratory will also check to see if you have antibodies to blood. Patients may develop these antibodies, an immune reaction, after exposure to either the baby's blood during pregnancy or to a previous transfusion. For safety reasons, the blood bank requires that your blood group be tested twice on 2 separate occasions before blood can be issued. This allows us to be confident about your blood type. The blood bank will then select a unit for you and label it with your name, hospital file number, and your date of birth. A cross-match is performed to ensure that the blood group of the donor is compatible with you. Especially you need to do on the morning of your transfusion. You can eat normally and take all your regular medications. Each unit of blood will be run over 2 to 4 hours, depending on how fast the blood can be run. Patients with heart problems must have their blood transfusion run slowly to prevent breathing problems. The nurses will start an intravenous. The nurses will take your temperature, heart rate, and blood pressure before starting the transfusion. The nurses will check the blood with either a computer barcode reader or with a double check by 2 nurses to ensure you get the right unit with your name on it. The nurse will then start the transfusion. Other than a slight cool feeling as it begins infusing, you should not feel anything else. The nurse will run the blood slowly for the first 15 minutes looking for any reaction. At 15 minutes, the nurse will recheck your temperature, heart rate, and blood pressure. If there are no changes, the nurse will increase the rate of infusion to complete the transfusion of each unit over 2 to 4 hours, depending on the rate set by your doctor. Most patients need 1 or 2 units or bags of blood at each visit. There are 2 common minor reactions that we see during transfusion that cannot be avoided. About 1 in 100 patients develop hives, which is a type of itchy rash. This is a minor allergic reaction that almost always goes away with antihistamines, and then the transfusion can be continued. The second type of reaction is a fever. It happens in about 1 in 300 transfusions. The blood cells and the blood products sometimes release flu-like hormones that can cause fever.
These reactions usually go away quickly with medications such as acetaminophen, commonly known as Tylenol. Numerous steps ensure that the risk of having a blood transfusion is as small as possible. The donor is asked to answer questions about their health and medical history. Then the donor is taken into a private room with a nurse to ask questions about high-risk behavior for HIV and hepatitis. The nurse will also check the donor's temperature, heart rate, and blood pressure. To minimize the risk of bacteria entering the blood product, the donor's arm is thoroughly cleaned. Also, the first few tablespoons of blood is used for testing, further reducing the risk of bacteria entering the blood bag. The blood is tested for HIV, hepatitis B and C, syphilis, West Nile virus, a virus that causes leukemia. Despite this testing, there's still a remote risk of these infections from blood, as shown on this slide. This is because there is a short period between when the donor becomes infected and when these tests become positive. For example, this is about 10 days for HIV.
সুস্থ থাকার সেরা ঠিকানা ILS হসপিটাল, আগরতলা। At ILS Hospitals, your health is our happiness.